Welcome to Menopause Rescue. I'm Dr. Polly Watson. Midlife women are often caught up in a sea of symptoms. Too often, they're overwhelmed by the lack of support from mainstream healthcare. They're inundated with so-called experts who are selling solutions which may lack credibility. I'm a Menopause Society certified gynecologist with both traditional and functional medicine training. I'm here to guide you through this transition and help you decipher the facts from the fads. Armed with credible information, I hope you are empowered to rescue and restore your health, making the second half of your life your best. Welcome to Menopause Rescue. I'm Dr. Polly Watson. Today we're going to talk about lack of focus and all of the complaints I hear about brain fog and not feeling as sharp as we want to be. I think this is such a tricky topic because we definitely know that as our estrogen levels are changing in the perimenopausal period, we do have challenges with working memory and word finding. And we do have evidence that replacing estrogen during this time can help. So that's fantastic, and we definitely want to use that tool. But what I wanted to talk about today was some other things that we could explore that we might layer on in addition to hormone replacement therapy when appropriate. And I also just want to kind of hold some space for when we're in this menopause transition, we're often, juggling a lot of things. We're juggling sometimes caring for older parents that might need physical or medical help. We've got children that are trying to launch and maybe navigating their own transitions into adulthood. And we may have a lot of feelings about that. I am feeling all the feels about that as my oldest enters his senior year of high school. And then at this moment, at this midlife point, many of us are pushing up against the glass ceilings in our career. And so it's really not a time to step back. It's a time to push forward. And so the demands are high socially, professionally. It's just a really intense time. So a lot of women are feeling overwhelmed. A lot of women are feeling like their brains aren't working as well as they want. And they often come in and say, is this early dementia? What's going on with me? So like we said, hormones can help. A lot of that work was done by Dr. Pauline Mackey at UChicago, and we know that that can help. And what I want to focus on today is what are other things we need to make sure of. The first thing is to make sure that before we go taking herbs and supplements and all of these things, we need to make sure the basics have been checked, right? Has your thyroid been checked? How's your blood sugar? Do you have vitamin deficiencies? Are vitamin B's sufficient, particularly if you're having an exclusively plant-based diet? What about vitamin D? Are you anemic? A lot of perimenopausal women are having really heavy bleeding and are anemic. And when you're anemic, nothing works. So that's important. Making sure that you don't need to get evaluated for sleep apnea, right? So all the lion's mane mushroom in the world does not matter if you're not getting oxygen at night when you sleep. So if you snore a lot, if you're waking up gasping for air, if your partner says, hey, you're waking up the whole house with your snores, you should get evaluated for sleep apnea. Many medications can be anticholinergic. So oftentimes allergy medicines are in this class of drug. A lot of antidepressant medicines are in this class of drug. And sometimes we don't even think about grabbing an allergy medicine and understanding that could affect our brain. We typically see anticholinergic medicines really start to affect cognition, especially as we get older. In that same context, older people are often taking many more medicines. So we start adding and layering on these different anticholinergic medicines, and then combined, they can have a really significant effect. Work with your healthcare provider, look at the medicines you're on, seeing if that could be contributing. I've mentioned this before, untreated hearing loss is a cause of 8% of all dementia. It's so hard, right? Because our kids mumble. Everybody's not got their earphones in and they're looking at their phone and they're not making eye contact. And sometimes it's really hard, like, can I just not hear you? Or are you mumbling? So, if your friends are telling you that you're yelling at the dinner table, go get your hearing checked. I see a lot of women not eating adequate amounts of protein. We're in the South. It is hotter than heck. It is hotter than heck in a lot of the country. Are you replacing electrolytes, right? So just want to make sure the basics have been covered. I think the other thing just to sort of hold space for is modern life, right? So I remember when I was working in the conventional space and I was one-on-one with a patient. I'm supposed to be typing into the electronic health record while I'm listening to them, prescribing their medicines. And at the same time, there was a messaging feature in the electronic health record where the triage nurse could be pinging me about filling out some form for someone's prior authorization. And she wanted an immediate response while I'm in a patient appointment. And I can't do all of those things at once. That was very not great for me. A lot of people are, looking at their phone, texting with someone while they're on a webinar. Like, our brains are not designed to do multiple things at once. Multitasking is a myth. So many of us do much better by block scheduling, not looking at email 16 times a day, looking at email twice a day. If you choose to engage with social media, set some limits on it. Do the thing that you're doing and clear everything else off your desk. Close the windows. Create an environment where it's easier for you to focus. It might be fantastic to take a break from social media or news feed notifications and try to really get some headspace back in your day so that you can regain some clarity. So just simple things, right? But I think that, when I look at my kid and my kid is listening to a podcast while he's trying to study, it's not conducive for learning. So we really need to do one thing at a time. Other really basic things are making sure your blood sugar is steady. And I know Kate and I have talked about this a lot with continuous glucose monitoring. And if you haven't seen those episodes, you might want to go back and take a look. But we're really trying to have stable blood sugar throughout the day. We're not getting really high blood sugar. We're not getting really low blood sugar. So we're thinking about half your plate is non-starchy vegetables, a palm-size amount of clean protein, regenerative beef, pastured chicken, wild-caught fish, organic soy, beans, whatever that looks like for you, 2 fingerfuls of healthy fat, and then complex carbohydrates. And I would kind of think about dosing carbohydrates in relation to my amount of activity. So if I'm mostly sedentary, I'm going to eat less carbohydrates than if I'm exercising a lot, particularly doing endurance activities. But when I think about carbs, they're not all bad. We want to have high quality carbs. We want to be focusing on things that have fiber intact. So people will say, well, I eat whole wheat bread. I'm like, well, once you grind the flour and, grind the wheat into flour, it is no longer whole, right? So black rice would be great. Quinoa would be great. Sweet potatoes would be great. You can get buckwheat grouts. That would be fantastic. But you want to think about intact grains if you're eating grains. And lastly, with the basics, just a touch on sleep. So many women are burning the candle at both ends, right? Again, we're kind of pushing up against that glass ceiling. Our families are really asking a lot of us. We're trying to serve a lot of different goals. And again, all the lion's mane mushroom in the world isn't going to matter if you're only getting 4 hours of sleep per night. And so really prioritizing having enough time to sleep and then really thinking about sleep like as a parent with a kid, right? When you're trying to get a kid to go to sleep, you don't let them watch, gosh, I'm really going to date myself. The first cartoon that comes into my mind is Tom and Jerry, but you're not going to let them watch violent TV right up until the point that they need to go to bed, right? There's going to be dinner and then maybe a walk after dinner, and then maybe there's going to be bath time, and then there's going to be story time. And then your kid has done this so many times that it's really time to wind down at that point and go to sleep. So you want to think about setting up some ritual, setting up some relaxation time around the end of your day. So you're not closing your work computer at 10 o'clock at night and then expecting to jump into bed and fall right asleep. You're closing your work computer hopefully many hours before that. And maybe you take an Epsom salts bath, or maybe you do some breath work, or maybe you do some meditation. Maybe you've discovered tapping. Maybe you do a little bit of gentle yoga. Set yourself up for success and give your brain some breaks. Exercise is fantastic for our brains. We can certainly talk about this in other venues, but weight bearing exercise is super important for us at midlife. I think that in terms of brain health, we know high intensity interval training can be really fantastic. Getting outside in nature can be fantastic. I'm not going to really put a lot of parameters on exercise. I would say just get out there and do it. You're trying to shoot for at a minimum of 150 minutes a week. Gold star if you can get 300 minutes a week. So you're thinking about an hour of exercise 5 days a week and maybe 2 days of active recovery. That might be something like stretching or yoga, less intense yoga. I know yoga can be intense. And then I just also wanted to kind of bring up, harkening back to our episode with Dr. Laura Salyer. In that episode, she talked about the Flow Research Collective, and there's a handout associated with that episode where she talks about giving your brain a break, right? So most of us are not going to be able to focus for hours and hours and hours on end. Most of us are, if we're really in the zone, are going to be able to concentrate well for about 90 minutes. And then after that, even if we feel like we've still got it going on, we need to give our brain a rest. That can be going outside and walking around the parking lot. It could be calling a friend. It could be doing some stretches. I really love getting up out of the chair, doing some hip openers, bringing a mat to work, doing a few yoga poses, doing some cat cows. Reset your mind by resetting your body. That can be so powerful for women that are maybe like me, maybe like a little bit type A, a little bit in your head. Sometimes it's hard to jump straight to meditation. Maybe you can use movement as a brain reset to hopefully get to your next focus session, but give yourself some breaks. I always like engaging another sense. So if that means having some really delicious herbal tea, if it means smelling some essential oil, if it means putting on some really delightful hand cream, hopefully that doesn't have any chemical fragrances in it, engage a different sense to kind of reset your brain. That can be helpful. Okay, so once we've made sure that there's not something medical going on, you're not chronically anemic, your thyroid's not broken, if hormone replacement therapy is appropriate, you're already on that. What else can we do from an herbal or nutraceutical standpoint that can help, that has some data to support it? So the first herb I'd like to talk about is Bacopa. And we do have some human data on Bacopa using doses between 300 milligrams and 650 milligrams daily. And we have seen some beneficial effect in cognitive performance, verbal learning, delayed word recall, the acquisition of memories, and additionally decreasing anxiety. So this is a really great option for someone who's kind of got that gerbil wheel going in their brain all the time, and that noise is making it really hard for them to get some task done. I would just want to jump in and say, if you're on any psychiatric medications, you would want to communicate with your psychiatrist before you took anything different, okay? Particularly if people have mania, bipolar disorder, you may really want to exercise some caution with adding anything herbal to your mix. You want to make sure that you're working in conjunction with a person that's providing your psychiatric care. So just kind of little friendly neighborhood reminder there. The Bacopa can be really helpful for focus. I like the Pure Encapsulations blend. It's called Brain Reset, and it has Bacopa in it. Gaia Herbs makes just a straight up Bacopa. For those of you that are in North Carolina, Gaia Herbs is relatively local. They're outside of Asheville and a really great company. So both of those are great sources for Bacopa. The next one I want to talk about is holy basil or Tulsi. Holy basil is neuroprotectant as well as helping with anxiety. It also is an adaptogen, meaning it helps us manage our cortisol, manage our stress a little bit. You can do it as a tincture. You can do it as an extract that you take as a pill. Again, Gaia Herbs has a nice holy basil. I do it a lot in tea. So this is kind of my go-to summer tea. I like this Tulsi Rose tea made by Organic India, which you can get at a lot of grocery stores. They have it at Whole Foods. And I don't like it hot. I like it cold. So if I have a big old mason jar of just plain cold water, I'll throw 2 bags of the Tulsi Rose tea in there, and it's very floral. It's very fragrant. You feel like you're giving yourself this little gift when you put your nose in that glass of water, because it's like you're smelling flowers, right? And if you just let it sit, while your morning's getting going, and then you can sip on it through the day goes by, I feel like it gives me this sort of nice, calm focus. So that's a nice one to try. Um, not all of my patients love the way these teas taste. I think it's delicious, but if you don't like holy basil as a tea, you can take it as a supplement. And then the last one I wanted to mention is lion's mane mushroom. And we do have studies in humans that show improvement with cognition with doses of 350 milligrams of lion's mane 3 times a day for 12 weeks. We can see doses much higher than this, and oftentimes 3 to 5 grams a day is recommended. So that's a lot to take in pills. Oftentimes, this is supplied in a powder that you could add to a smoothie, or if you have yogurt, put in yogurt. I think it would be easiest to hide it in a smoothie. I wanted to bring up a couple of companies. So typically when you're looking for a mushroom product, it's really fantastic if you could find the fruiting body of the mushroom versus the mycelium. So 2 companies that have the fruiting body of the lion's mane, Four Sigmatic is one. So Four Sigmatic makes protein powder that I really like. They make coffee. They also just have a focus blend that is a combination of both the lion's mane mushroom and the bacopa. There's a company called Malama Mushrooms out of Hawaii, and they have what I thought were really good prices on just lion's mane powder that you could buy and add to a smoothie. So hopefully those are some options. Once you've kind of checked the basics, make sure we're not missing anything serious. Really try to optimize your environment and give your brain the exercise and rest that it needs. If you're doing all the things and you're still struggling, maybe try a little bit of lion's mane, consider some bacopa or holy basil. And then obviously, if you're under the care of a psychiatrist, particularly if you're on psychiatric medications, you would always want to run any changes you make with your healthcare provider before making them. Hope this helps. Hope you have a little bit more focus now that the beginning of the school year is upon us. Have a great day. Thanks for listening to Menopause Rescue. We hope you've enjoyed this podcast and it helps you create some time and space to make this the best half of your life. If you've enjoyed this content, please leave us a 5-star rating and review. This helps other listeners find this resource and rescue and restore their health. If you enjoyed this topic and want to learn more, check out our resource guide for this episode. If today's podcast resonated with you and you want to take a deeper dive, check out my educational resources. We offer basic membership, which is an archive of over 100 videos on menopausal topics ranging from bone health to libido. We add to this archive every month, so the resource becomes richer and richer over time. If you're looking for a menopause expert and live in North Carolina, take our free online class and see if we're a match for your needs. It's called Are We a Good Fit? And is a quick and easy way to learn more about our practice and what it has to offer. Hey, this is Dr. Watson. This is just a friendly reminder that this podcast is for general information purposes only and does not constitute the practice of medicine. No doctor-patient relationship is formed, and any information you get from this podcast is considered educational only. You should make medical decisions with your healthcare provider. The content of this podcast is not intended to be a substitute for professional medical advice. Listeners should not disregard or delay in obtaining medical advice for any medical condition, and they should seek assistance from their healthcare professionals.